In this practicum, we are going to be explaining how to properly fill a syringe. In the process of filling a syringe, it is placing a medication or vaccination into a syringe, and then once the syringe is filled, it can be used for administration through a variety of methods, including intramuscular, intravenous, or subcutaneous. A veterinary assistant, a vet technician, or a veterinarian themselves in a vet clinic can properly fill a syringe. Step 1 is to determine the amount to be placed in the syringe. This will be based upon the type of vaccine or medication you are given, and for some of those different types of medications, there are specific dosages based on weight or size of that animal. Step 2 is to select the proper size syringe. You're going to want to select a syringe that has a volume slightly larger than the dose being administered. And then when you're selecting that needle, the gauge of the needle should be determined by the patient's size, the thickness of the liquid, and the rate of the injection. And the greater the diameter of the needle, the lower the gauge. Continuing on through selecting the proper size syringe, you're also going to want to look at the needle length for your needle. And that should be based on the type of injection and the depth of injection to which you are giving. So a short needle would be used for a thin-skinned animal, and then a longer needle would be used for an intramuscular injection. And there's a chart showing some different recommendations of length for different types of injections. Step 3 is to insert the syringe into the top of the bottle. Notice there is a circled area on the top of the bottle to which you're going to want to inject that needle into that specific area. Step 4, place the bottle upside down in one hand and hold securely. Step 5, withdraw the proper volume to which you want to administer. Step 6, remove the syringe from the bottle. Step 7, gently tap or snap the edge of the syringe to remove the air bubbles, or slightly expel the air by pushing the end of the plunger. You can do this by tapping the side of that syringe and the air bubbles will float to the top. And when they do, when you slightly expel on the end of the plunger, you will release that air. The last step is to place the syringe in the sharps container. It is not recommended nor necessary to cap the needle at this time. Once that syringe has been used for the administration to which it was intended, immediately place it in the sharps container to prevent any type of contamination.
Hello, my name is Courtney Jones and I am a registered veterinary technician, and today I will be properly demonstrating how to fill a syringe for injection. Filling a syringe is one of the most basic common knowledge you can know in the veterinary field. It is something you will be using over and over again every hour, every day of when you are there. To start, I'm going to determine the amount to be placed in my syringe. Depending on the amount we will be placing in the syringe will depend on which syringe we will be working with. For example, this is a U40 syringe. This is most commonly used when giving insulin injections, since we work with units and insulin. So if we're using something that has to do with units, we will be using this syringe. If we are working with a liquid If we are working with an injection and we are giving less than 1 ml, then we will be using this syringe. It's a TB or tuberculin syringe that only goes up to 1 ml to make our volume or measurement more accurate. And if we're giving an injection of more than 1 ml, then we will be using this syringe. It's a 3 ml syringe that we can use, and then there are syringes that go up from here. For example, a 6, 12, 20, 35, 60 cc syringes. So just depending on the volume that we will be extracting from the vial will depend on the the syringe we will be using. The needle that we will be using will also depend on the liquid we will be drawing up. For example, if we're drawing up a liquid that has a thicker viscosity, then we will be using a larger bore needle like an 18 gauge. However, when actually injecting this, for example, if we're giving a thick liquid like carprofen or Rimadyl to a Chihuahua, we will want to draw that up and give it with a 20 gauge needle. However, if we were giving a different injection like ampicillin to the same Chihuahua, we would rather use a 22 or even a 24 gauge needle to be more comfortable for that Chihuahua, since their size is so little. And as the animal's size increases, we'll also depend on the size needle. So if the animal size increases, the size needle will also increase. I'm going to select a proper size syringe. So for today we'll be using sodium chloride, and we will be drawing up 0.4 mils of the sodium chloride. So I'll be using this TB or tuberculin syringe to make that measurement more accurate. Once I've selected the proper type of syringe and needle, I'm going to insert the syringe into the top of the bottle and tip this bottle upside down and draw out however much is needed. Like I said, is 0.4 mils. Once I have the correct volume inserted into my syringe, I will remove my needle from the top of the vial and snap or tap the edge of the syringe to remove all air bubbles and push my plunger so that the air bubbles has been removed. Once I have given this injection to my patient, then I will place this whole syringe in the sharps container. I'm going to properly demonstrate how to fill a syringe for injection. I'm going to determine the amount to be placed in the syringe. I will be injecting 0.4 mils of sodium chloride. I'm going to select the proper syringe, which will be a TB or tuberculin syringe, which is a 1 mil syringe. I'm going to insert the syringe into the top of the bottle and place the bottle upside down in one hand and hold securely. I'm going to withdraw the proper volume, which will be 0.4 mils. And I'm going to remove the syringe from the bottle and gently tap or snap the edge of the syringe to remove any air bubbles. I'm going to slightly expel the air by pushing the end of the plunger. Once my injection has been given, I'm going to place the syringe into the sharps container. And that is how you properly fill a syringe for injection.
In summary, to properly fill a syringe, determine the amount to be placed in the syringe, select the proper size syringe and needle, insert the syringe into the top of the bottle, place the bottle upside down in one hand and hold securely, withdraw the proper volume, remove the syringe from the bottle, and then gently tap or snap the edge of the syringe to remove air bubbles, or slightly expel the air by pushing the end of the plunger. Then place the syringe in the sharps container.